Now coming to question 3 of previous year NEET question 2025 in cardiology department. So to solve this case, again we have to read from the last line. Which of the following is the most appropriate agent to add to his current regimen? So we understand that some drugs will be given in the question. We have to think of any drug which has to be added extra. A 60-year-old diabetic patient is currently on metformin and insulin mixture. His HbA1c is 9%. Echocardiogram shows ejection fraction of 32. So we'll write down the clues here. So an elderly patient, 60 years old person, is having diabetes and he is on 2 drugs, metformin as well as insulin, and his HbA1c is 9. So please remember, the normal HbA1c is less than 5.6%. Normal HbA1c is less than 5.6%. When HbA1c is more than or equal to 6.4%, it is labeled as diabetes. The values in between 5.6 to 6.3, 5.6 to 6.3, it is as pre-diabetes or impaired glucose tolerance. So less than 5.6 HbA1c is normal, more than or equal to 6.4 HbA1c is called diabetes. Values between 5.6 and 6.3 is impaired glucose tolerance or pre-diabetes. To say a controlled diabetes, HbA1c has to be less than 11. To say controlled diabetes, HbA1c has to be less than 7%. This patient is having HbA1c of 9, which means despite taking 2 drugs, he is having uncontrolled diabetes. So we are having a 60 years male with uncontrolled diabetes despite 2 drugs. So we have to add a new anti-diabetic drug. His ejection fraction is 32. Ejection fraction is a finding which is picked up in an echo, which is the pumping capacity of blood. So EF is less than 32. So this would have been discussed in physiology. Ejection fraction, something tells about the pumping capacity of the heart. In medicine, just remember the term heart failure. Heart failure is failure of the pumping capacity of the heart, or a problem with the pumping of the heart. Arrhythmia is a problem with the rhythm system of the heart. Heart failure is a problem with the pumping system of the heart. Coronary artery disease is a problem with the vascular system of the heart. Right? So when EF is 32, it's a problem with the heart failure or the pumping capacity. Based on ejection fraction, they have classified heart failure into 3 categories. Heart failure with reduced ejection fraction, where ejection fraction is less than 40%. We have heart failure with preserved ejection fraction, HFpEF, where EF is more than or equal to 50%. Then we have the mid-range heart failure with mid-range ejection fraction, where EF is between 40 to 50. So this patient, by the example, they are given EF is 32. So he comes under the category of heart failure with reduced ejection fraction. Whenever there is a heart failure with reduced ejection fraction, there are something called as pillars of heart failure. Even if this seems too much to you, just hear these names once. There are 5 pillars of heart failure: ACE inhibitors or ARBs. ACE inhibitors, angiotensin converting enzymes inhibitor, all the drugs which end with the name pril, like enalapril, captopril, ramipril, anything which ends with pril is an AC inhibitor. ARBs, angiotensin receptor blocker, anything which ends with sartan. So like losartan, telmisartan, olmesartan, these are ARBs. Remember, these act on the sequential steps. So you know very well that angiotensin converting enzyme converts angiotensinogen to angiotensin. That angiotensin acts on angiotensin receptor to have its effects on vasoconstriction. So angiotensin converting enzyme and ARBs inhibit sequential steps. So these two should not be given together. So the second pillar of heart failure with reduced ejection fraction is a beta blocker. The third pillar is aldosterone antagonist. They say as mineralocorticoid receptor antagonist. Remember one drug name, aldosterone. Sorry. The drug is spironolactone and eplerenone. Spironolactone and eplerenone. These are the two mineralocorticoid receptor antagonist or aldosterone antagonist. The fourth pillar is ARNI. ARNI stands for angiotensin receptor blocker plus neprilysin inhibitor. So I already told you any angiotensin receptor blocker ends with the term sartan. So I will take one example, valsartan. This neprilysin. Neprilysin is a substance which breaks down angiotensin. Okay, neprilysin is a substance which breaks down Neprilysin is a substance which breaks down the ANP, atrial natriuretic peptide. So remember, atrial natriuresis. Natriuresis is the process by which sodium is excreted from the body, which is doing good to the body by reducing blood pressure and volume overload. So when neprilysin gets inhibited, ANP is not destroyed. So ANP increases. When ANP increases, again it is doing good to the body. So one example for neprilysin inhibitor is sacubitril. So ARNI is nothing but a combination of two medicine. Angiotensin receptor blocker, which is doing good by blocking angiotensin 2, and neprilysin inhibitor is another drug which is doing good to the body and blood pressure by reducing the degradation of atrial natriuretic peptide and increasing its level. So sacubitril valsartan is its name. So this may be asked in pharmacology. Okay, so coming to pillars, ACE inhibitors or ARBs, beta blockers, mineralocorticoid receptor antagonist ARNI, and the fifth pillar is SGLT2 inhibitor, sodium glucose cotransporter 2 inhibitor. If you remember physiology, SGLT2 is a channel which is present in the proximal convoluted tubules of kidney, and the name suggests sodium glucose cotransporter. The function of SGLT2 in kidney is to reabsorb sodium and glucose from the tubules to the blood from the proximal tubules of the kidney. So since glucose is reabsorbed by this channel, when it is inhibited, the excess glucose is excreted by the urine. So it is an anti-diabetic drug. So SGLT2 inhibitor is an anti-diabetic drug. By excreting sodium and glucose, what does it do? It can reduce the BP. So it is good for the heart and it is good for the kidney. Okay, so it is cardioprotective and nephroprotective. So that is how this drug is useful. So SGLT2 inhibitor is an anti-diabetic, it is cardioprotective and it is nephroprotective. So the examples for SGLT2 inhibitors is anything which ends with flozin, dapagliflozin, empagliflozin, anything which ends with gliflozin, canagliflozin. So where we started with the 5 pillars of heart failure. SGLT2 inhibitors is one drug which is an anti-diabetic, which is a pillar for heart failure, as well as it is nephroprotective. So we'll read the options. Pioglitazone, don't get carried away by the name. Pioglitazone is an anti-diabetic drug which is a PPAR gamma agonist. It is one drug apart from metformin which helps to treat insulin resistance. It is also called as insulin sensitizer. So if someone asks you the question, which are the insulin sensitizers or which are the drugs used for insulin resistance, we have two. One is metformin and other one is PPAR agonist, PPAR gamma agonist. Remember, there is another category of drug called PPAR alpha agonist. These are actually drugs used in dyslipidemia, hypercholesterolemia. We have something called saroglitazar. It is a drug used in fatty liver. It is both PPAR alpha and a PPAR gamma agonist. Okay. So pioglitazone is a PPAR gamma agonist used in diabetes. Glimepiride is a sulfonylurea. Sitagliptin is a DPP4 inhibitor. Again, it is an anti-diabetic drug. Dipeptidyl peptidase 4 inhibitor. So what is this dipeptidyl peptidase? Dipeptidyl peptidase is an enzyme which breaks down GLP-1. So in recent days you would have heard about GLP-1 receptor agonist, semaglutide, tirzepatide. These are drugs which are used in weight loss and in diabetes. So DPP4 is a peptide which breaks down GLP-1. When DPP4 is inhibited, GLP-1 increases. Remember, GLP-1 is a insulin secretagogue. It helps to secrete insulin. Okay. So sitagliptin is actually a good drug, but remember, the one drug which is used in heart failure among anti-diabetic drugs is SGLT2 inhibitor. So it is empagliflozin. Right? So this question is about heart failure and anti-diabetic drugs. We just combined both.